The Health Department says it's concerned by the increasing number of fraudulent medico-legal claims. These are made due to medical negligence, these claims. According to the Auditor General, medical negligence claims have increased in the country by 10% in the last 5 years, costing the Health Department 77 billion rand. The AG and the Health Department, led by Deputy Minister Sibongiseni Dhlomo, briefed Parliament on how these claims affect provincial budgets. In fact, the Deputy Minister joins us for more this morning. Dr. Dhlomo, it's great to have you with us on the program. And that number is quite shocking, isn't it? 77 billion rand. Can you give us some clarity on the period we're talking here? For how many years does that 77 billion account for?
Good morning, Michelle, and good morning to our viewers. This is according to our records and what the AG also brought before the Select Committee 3 financial years across the whole country. And I must also quickly correct, it's not only illegitimate or fraudulent claims. Some of them are legitimate, and we are addressing that part. But where we're coming in very strongly, Michelle, is that there is enough evidence that if you are not having your electronic records, medical records kept electronically, you're likely to actually get into the space of illegitimate claims because you have no backup, you have nothing to show against any person who comes in fraudulently. So that is one of the things that we are talking about, and which actually came out from the summit that we had in 2015. There was a medico-legal summit held in 2015, and quite a lot of recommendations were up there. One of them is the one that I've just made reference, but if time allows, I'll give you more. But that if you improve as hospitals, both private and public, on medical records being electronic, you are likely to be able to stand any ground, anybody making a claim, and indicate that this is what we did, and vis-a-vis any other fraudulent claim that comes into the picture. Right.
So that's important for clarity, Deputy Minister. The medical negligence claims in total are 77 billion. So which portion of that would you say are fraudulent?
It's very difficult to say because you have to actually sift through that. We did not separate them in that space. We actually get into these medical claims and therefore separate them in terms of we have created certain structures in all provinces of multidisciplinary teams that will interrogate any claim and look at it and say, this one, let's start to look at it and mediate if it's necessary, and also find our own records and work around it. So this is just a lump sum. For now, me and you here will not be able to come to differentiate these ones because it's work in progress. We just lump them all together as these are the claims. And therefore, we have to interrogate them one by one. And there are very capable teams also. That is part of the recommendations of 2015 to say, Department of Health, go out there and create multidisciplinary teams that will have doctors, lawyers, and other experts to interrogate and look into these claims as they come up and be able to sift through and then start mediation if necessary. Don't go to court if it is not necessary. Pay just there and then deal with those that you can think are fraudulent. So that process is also ongoing.
Yeah, absolutely. And it's important also to say, Dr. Dhlomo, as we cover the story, that where there is medical negligence, it is the duty of the department and for the health sector in general to pay those claims, right, where there is proven negligence. The problem, of course, becomes when record keeping is so bad that records that could have been used to defend those claims in court on the part of the health department don't exist, and so perhaps these fraudulent claims are paid out more often.
Absolutely key. That is why we are even saying, Michelle, if you do not have online records for to date, if there is any misdemeanor that you suspect might end up being an issue here, why don't you then photocopy those records and then keep them in the CEO's office? Because sometimes they do disappear because somebody would come into our own space. So any issue that you think might take us to court, keep those copies, make duplicates and therefore keep them so that you could be able to defend yourself. But Michelle, we are very excited with some of the court findings in our favor that says, if then you have to pay, do pay for that misdemeanor, that cerebral palsy. But what we call future medical treatment and expenses, we can hold back to that and be able to show in the country which hospitals are likely to support you for the future medical treatment of that child or of that person. And then in that space, we don't then have to pay that lump sum. I think that has really been very helpful to us, because now as a department, we need to accelerate improving hospitals to a level where all those children who have cerebral palsy, those other misdemeanors, can find a physiotherapist, an occupational therapist, a pediatrician, a doctor, or any other person who then needs to give the full complement of support to that type of an individual.
It also points to the health department across provinces, and some provinces are worse affected than others, Dr. Dhlomo. The Eastern Cape, for example, comes to mind as one that stands out for its gaps in healthcare for South Africans. And it points to where the serious holes in our health services do exist as well.
On that one, Michelle, is multifactorial. We need to up our game again in terms of, yes, I was trained 20 years ago, but how often do we get refresher courses, which we call very important, which we think are very important, refresher courses for nurses, doctors, and everybody else, so that you do what we call fire drills and mimic a situation that it exists and say, if this situation were to come, by the way, how do we handle it? That helps and it builds the confidence on our staff members. But again, there's another very important factor, Eastern Cape being one of the worst affected, the topography of the area. If you have to, as a nurse or a doctor in a far-flung clinic or hospital, notice that we are not going to be successful with this patient delivery, let us therefore make a referral much earlier to a bigger facility. Now, the challenge of the roads and infrastructure and all those issues, the ambulance availability on time, does impact on some of these issues that we are trying to put in place. So more rural provinces with some of those challenges of the road infrastructure and the distance that the ambulance has to travel to the bigger center will also impact on terms of these issues that we are talking about.
Yeah, the focus needs to shift to patient care more than anything else, and that will then filter down to less of these negligence claims, hopefully, coming to the fore. We know the impact that this has on provincial budgets as well, Dr. Dhlomo. Millions, tens of millions, hundreds of millions being paid out in these medico-legal claims. As we say, a bulk of that is fraudulent claims. What kind of impact have you already seen does this have on service delivery, where so much money is being spent on this issue?
The best example is what was even outlined by the MEC for Health in the Eastern Cape then in terms of the budget. I think she was actually explaining that as a province they get about 27 billion as health budget, and two-thirds of that will obviously go to the compensation of employees. Therefore, they remain with 9 billion. Of that 9 billion, I think about 3 billion is to actually pay what was the previous year's budget that was not paid for to really deal with them. So they remain with negligent about 6 billion to really navigate through all programs. So it does impact significantly in terms of us providing a service, because we also don't even budget for these medical-legal claims, and if you do, you can't even tell how much to budget. So the more we can accelerate improving, decreasing the medical-legal claims, the better we are going to be in a space for service delivery. It impacts significantly across all provinces in terms of the budget.
Some analysis on this issue, Dr. Dhlomo, has also brought out the claim that the legal fraternity in many aspects is actually targeting this sector for legal claims, for fraudulent claims. Is that what you're seeing as well, that perhaps there is a renewed focus on medico-legal claims?
You probably might be aware, Michelle, that there was also a targeted fraud on the road accident fund. Some of those unscrupulous individuals who have been dealing with that type of a setup are now in health. They actually queue in our hospitals. They ask patients as they leave, what did they do to you? Do you think they did anything wrong to you? And therefore, some of them even collude and get into our own space. We don't say as health, as any other service delivered, we will not be liable for making some mistakes. We would pay for some mistakes, but the way they were being targeted, people actually camping in our hospital premises ready to pounce into any of the things that we do, is actually has been on an increase. And unfortunately, Michelle, some of those unscrupulous leaders who come in that space and assist those patients, two-thirds of what is claimed never gets to the recipients. It gets to be into a space of a particular trust that never gets into. So not only are they there for the interest of the people who are claiming, these people do claim millions and millions, but they go out there and struggle in poverty, unable to configure the house that was meant to be configured for a cerebral palsy and all that. So those are all the issues that we want to. But very importantly, we have finished that report to close, Michelle. There is a forensic investigation that we did as a province, as a country, and that report has been, through the presidential proclamation, handed over to the SIU, and the SIU is actually finalizing the reports of the forensic investigations done by the Department of Health on these issues.
Dr. Sibongiseni Dhlomo, the Deputy Health Minister, important story this. Thanks very much for joining us.